Well, let's move on now and move to our second segment here. We want to talk about the crossroads of innovation, coverage, and competition, which, as you can imagine, pretty much includes everything that we might talk about. I want to start with competition in the insurance market. This summer, July in particular, was merger month, it seems, with three major mergers announced. There was the Aetna Humana merger, the Anthem Cigna merger, and the Centene and Health Net merger. All the largest really ever that were proposed. And if approved, of course, this is still undergoing approval by the feds, the Department of Justice, the big five insurers would consolidate to the big three. I guess a question is sort of, is this consolidation good? What's driving it? And I think both Austin and Leah, you'll have perspectives on this. Maybe Austin, we'll start with you.
Yeah, I'm not just going to give my perspective. I'm going to give the perspective of almost all health economists. There's unanimity on this issue that when you have consolidation among health insurers or providers, you generally don't get good results for consumers. What you generally get are higher prices, sometimes higher quality, but not always. And then and when you do get higher quality, you have to ask, is the higher quality worth the higher price? And an analysis needs to be done. But by and large, when you're consolidating from say 5 to 3 insurers, you're way past the point where you don't have enough to get the best deals for employers or for consumers.
But this has to be put in the context of a lot of mergers going on at the provider level too, right? And I know you know that, Austin.
Yes, absolutely.
You know, we've had unbelievable, I mean, if you look around Washington, D.C., there are some big systems that don't live near each other, but are carrying a common label. And it's kind of a branding exercise rather than actual on-the-ground difference in what goes on in these institutions. So you don't get the quality lift that you might expect from the higher brand necessarily, and you get this market power that is abused, actually.
So Leah, how about from your perspective? You work with employers who are, I'm sure, concerned about this. You do hospital ratings where you're seeing the product of this consolidation, probably in terms of delivery systems that are now part of each other that used to not be. Any thoughts on this topic?
Yeah, I mean, the industry has fundamentally changed in only a couple of years. It's very concerning. I think the studies that have been done on consolidations of hospital systems have not been promising in terms of what they deliver in terms of cost control or quality improvement. In fact, they do the opposite. The quality usually goes down and costs go up. So that consolidation trend is concerning. I'm sure it's prompting the consolidations we're seeing among health plans. That's also a major concern because that could clearly also increase costs. And I think employers for a long time have been frustrated, frankly, by health plans because they feel that they haven't gotten what they needed in terms of managing quality, really doing a good job with quality management and network selection. And I think part of what's motivating the consolidations or maybe making plans a bit nervous about the future is the fact that purchasers are getting much more aggressive in wanting to make sure that they're managing their costs more aggressively. I think they're doing a lot more of their own narrow network selections, more steerage of employees, much more transparency, as I talked about earlier, about pricing and quality. So there's really an emerging, more muscular purchaser out there. And I suspect that plans are beginning to wonder, well, what role are we going to play if the purchaser's going to do the part that involves quality and cost? So I think that is also motivating this, but both trends in the market, hospitals and plans, are very concerning.
Yeah, you know, this all comes at a point in time where the premium forecast on the exchanges are astounding. I mean, 20 to 40% premium increases, and some of that I know is trickling over to what employers are at least being predicted to pay. So on the one hand, we have projected high premiums kind of in the exchanges kind of for the next year. And some are arguing that this consolidation really is necessary in order to actually decrease premiums, to sort of deal with all the bureaucracy and the regulations and ultimately create efficiencies that will drive that down. I mean, what's the logic behind that?
You have a look on your face, Austin.
So this is where people, especially when they're promoting a particular agenda, kind of conflate different ideas and concepts. So there's no question that consolidation can, not necessarily, but can lead to efficiencies for the organization that is consolidating, right? They can merge their IT departments, they can merge their human resources, they can just streamline things, and that may reduce their costs, but that doesn't necessarily reduce the cost of those who are paying, because now this organization has bigger market power. And the same thing plays out when you have the idea, and I've expressed this as well, that maybe maybe insurance consolidation will sort of offset the provider consolidation. So you have the gorilla over here, and so you have the other gorilla over here, and they'll like bang heads, and it'll all work out. Well, it's possible, and in fact, studies do show that when insurers have more market power, they do get better prices from providers. They can negotiate those prices downward. But when you translate that to what consumers pay, which are premiums, that doesn't necessarily pass through, because now you have a larger insurer that can just command more market power in the market where they sell their product. So you can see, I mean, probably that was just confusing to most listeners, and so people are able to talk around this and talk about efficiencies and savings and so forth, and even point to some, but you have to be really careful. What price are they pointing to? Are they pointing to the price that the insurer pays the hospital? Or are they talking to the price the consumer pays the insurer? And those are two different things.
Yeah, you don't want the consumer being the bunch of bananas stuck between those two angry gorillas, right?
Well,
And
they
and
are.
all this, it's all about checks and balances. And with insurance companies and hospitals and other providers and payers and the consumer, when you tilt the market with consolidation, you run a real risk of upsetting that set of checks and balances.
And then
you need to be real careful.
I think too much focus on the premium is also a problem. I was in an Uber the other day, and I always talk to them about health insurance. And the guy says, well, it's him and his two children who are 6 and 10. And he picked the lowest premium on the exchange in Maryland. And his deductible is $6,500 a year. Okay, so he's an Uber driver. And he has another job doing property management, maintenance kind of stuff. But he will probably, they're all healthy, if he's lucky, he probably will never actually get an insured event. And think about it, it's all coming out of pocket because, now think about that in terms of what the public is going to sense in terms of the value of what they're buying. So I think the other thing about that is that these high deductibles, as employers look at that and as they look at the Cadillac tax, which we're going to talk about, it's very enticing to just go with a high deductible. It's kind of simple. There's a message you can tell, instead of like going back and sort of saying, well, we'll pay 50% for this and 80% for that and so forth. And so I think that there's a conflation of a whole lot of different numbers that's incredibly mystifying and angering to a lot of consumers.
Yeah, well, in terms of